Hi, it's Jaimy Blazynski, neural retraining specialist with Mast Cell Advanced Diagnostics, and I am here with Dr. Pizano to get some of your questions answered. Dr. Pizano, the big question that everyone is asking, what are the symptoms that people are going to be seeing that would indicate that they're sick with COVID-19?
Absolutely. So this is a tough one because it's a variable symptom kind of thing. So the first thing that I would say, the first symptom that we're seeing, not universally, but it's a strong one that we see in a large portion of individuals with COVID-19, is this loss of sense of smell and taste. So that actually has to do with the way the virus uses up the zinc, and one of the signs of zinc deficiency is that loss of smell and taste. So sure sign, definitely can be a problem. It's not a necessary, yes, I have this, therefore I 100% have COVID-19. We still need to look for other symptoms, but it is something that we need to be aware of. The big thing with COVID-19 is that people are getting infected, and it can take anywhere from 3 days to 2 full weeks, 14 days, in order to actually have their first symptoms, including that loss of smell and taste. And the reason for that is that the virus suppresses our immune system, and most specifically monocytes, which is a type of white blood cell, and natural killer cells. So when we have that going on, these are our first lines of defense. So if they're not alerting the rest of your immune system, you're not having any symptoms. Doesn't mean you're not contagious. That's the problem. You're contagious from, that first time that virus gets hold in your body. So we really need to be careful. That's why this social distancing and isolation is so important. As hard as it is for a lot of us to kind of stay home and stay safe, it's really important, because those first symptoms, when you're actually starting to get them, it's already too late. You've infected anybody you've come in contact with. Point, which is kind of scary, but that's something that's why we're all home. That's why the government has ordered us to stay at home, and do our thing, whether we're doing work or school or just taking care of family or taking care of ourselves, but we need to stay where we are. In terms of progression, it's super variable. For some people, they're going to have GI symptoms, particularly young kids. So young kids, we're often seeing primarily a GI bug. So they complain of nausea and tummy aches, and we see a lot of diarrhea, some vomiting, although the diarrhea seems to be more so than vomiting, especially as long as they don't eat. Like if you force the kid to eat, they'll typically get sick to their stomach. So not a great idea if you have a sick child who's saying that they're nauseous. Hydration, that's what you want to work on. So we do see that sometimes in adults, and then we will see certain respiratory symptoms. It doesn't typically cause sinus congestion, although occasionally you will see that. The primary effects are going to be lower respiratory, meaning your lungs are going to be primarily affected. They talk about this dry cough, or at least early on they were talking about a dry cough. It really isn't a truly dry cough, which means it's an unproductive, doesn't bring mucus up. Unproductive cough is a much better way to describe it, because the lungs are filling with a very, very thick mucus, making it very difficult to breathe. So if you talk to patients who've had this happen, they often complain that it feels like there's an elephant sitting on their chest, because it's so hard to get enough oxygen. We're seeing oxygen saturation. If people are in the hospitals that are dropping very, very low, it's very difficult for them to breathe. So certainly that's a strong sign that you have COVID-19. If you do have those signs, first of all, definitely reach out to your medical providers. If you're one of my patients, definitely let me know, but we're going to need to loop in your medical doctors as well. I think that, some of the things that we can do at home for that, lying on your belly really helps to bring the mucus up. So if you can lie on your stomach, that can help start to loosen things. And then on the hour, kind of try to forcefully cough some of that mucus up. That can be really helpful. In particular, because one of the secondary things that's happening for a lot of these patients that's driving a lot of people having to go to the hospital is secondary pneumonia. And that happens when we have all of this mucus in our lungs that is kind of pooling and not being coughed up. And then we get these secondary infections. So really important to make sure we're trying to get rid of some of that mucus. Sorry, go ahead. Your question.
This is excellent information. I think I have a question that probably a lot of other people are thinking. Is there a certain point in time where you should go to the emergency room, or should you stay home and
So what you want to do at first signs of any symptoms is call your GP for sure. They need to be looped in. We want to work on getting as many people tested as humanly possible. Even if you can't be tested, you want somebody following you. Most of these appointments are going to be virtual, so don't think your doctor's going to make you go into their office. In fact, that's the last thing they want. They can tell by the list of symptoms. I mean, I had a call earlier today with a patient, and you know, that's how we handle these things. So we don't want to expose all of our medical providers and everybody else. So going to the emergency room, you don't want to do that unless you're really in a bad state. If you can't breathe, you certainly need to get in. But if you're breathing and you're able to cough up that mucus, that will work. You want to call your doctors early on though, because if you're starting to have signs of pneumonia, they've actually found Z-Pak, the antibiotic, to be quite effective. Doesn't make a lot of sense for us, right? That's an antibiotic. And this of course is a viral infection, but it has some properties where it actually disrupts DNA replication, which slows the viral growth pattern and viral load. So it can actually be quite helpful. Not to mention sometimes when we have the development of pneumonia, we do get secondary bacterial infections, because anytime we have a nice moist mucousy place, we can have bacterial adhesion and secondary infections. So Z-Paks can be really effective. So you want to stay in close contact with your medical care team. Don't just stay in bed and pray that it gets better when there are things that they can actively do. Some of the newer research coming out of China, who obviously has a lot more experience than we do, is that early use of Plaquenil seems to be providing a lot of benefits. So if you're looking at a population like my practice, where we have some really sick patients, that's something else that, you know, your doctor may prescribe that's been really good in terms of stopping that DNA replication process. So, you know, there are medications that they can do and use to kind of keep you from having to go into the hospital. Personally, I've been using a lot of oil of oregano in my practice, which is going to work similar to the Z-Pak in the sense that it's not just, it's an antiviral, also antifungal and antibacterial. So it really kind of does that double duty. And it's, you know, when I started really early on with my patients, I've been having a lot of success keeping people from progressing into that cytokine storm place. So there are lots of things that can be done. There's not a lot of limitations in terms of what they can and can't use. And so, you know, doctors are using, you know, whatever antivirals they might have. They're using breathing treatments to help people. So they're doing albuterols and N-acetylcysteine. It would certainly be a good one for my mast cell patients. Nebulized cromolyn sodium, which is a mast cell stabilizer, can be really helpful in terms of the breathing aspect. So the moral of the story is everybody is going to have a slightly different outcome in terms of what medications we use, because especially for the kinds of patients I see, they're complicated. You know, one person tolerates one item, the other person's going to tolerate the other. So you definitely want to be working directly with your medical team on this, and not just, you know, follow things that you might have heard about from myself or somebody else, because my recommendations aren't identical from one patient to the next, but we need to address their specific issues in their medical context. So get with your care team, meet with them often. I know from my own patients, I'm having people just check in with me every few days via email. And if I'm not hearing from them, I'm checking in with them myself, or having one of my staff members reach out, because I think that contact is really important when we're going through this. The other thing to keep in mind is the fevers. We see people spiking fevers with this, and they will go up and down. One day you'll have a fever and then you won't. And then you will again the next day. So just because you feel like you're getting a little bit better doesn't mean it's all gone. That has to do with that suppression of those monocytes and the natural killer cells we were talking about. So just be aware of that. What I've been telling people is avoid all NSAIDs, so that's your Advil and aspirins and Aleve. These are all really not okay. You can only use Tylenol with this virus, and you only want to use it if you're spiking fevers at over 103. Anything below that, we're not looking at something that's dangerous for you. It might be uncomfortable, but that's your body fighting the infection. We want to give it every chance to get rid of this nasty virus. We only would use the Tylenol if we're getting really, really high, to prevent you from getting much sicker and having permanent problems like, damage to your tissues. You can, if you're really not sleeping at night because of fever, then, you could use it at bedtime just to be able to sleep, but we want to minimize the use of any of these NSAID medications.
Wow, this is some incredible information. I really appreciate this. It's comforting to hear that there are so many different options to treat this. And I think I speak for everybody. And I just thank you and all the medical providers out there that are doing the research, getting the information to their patients, and working these long hours to take care of people. We really appreciate your time, Dr. Pizano. Thank you.
Oh, my pleasure. And I do encourage any of my patients, if you are sick, please do reach out, because as I said, there's a lot that can be done. Stay
Absolutely.
home, stay safe.
Thank you.